Chapter 6. So we are talking about expenses, which is known as outflow. Reading from the book here, expenses are the costs that relate to the earning of revenue. So it costs money to make money. Another way to think of it is expenses is a cost of doing business. So just as revenue represents the inflow, expenses represent the outflow. Your book here on page 47 does a really good job at reiterating some of these ideas, so keep on reading that. Revenues and expenses affect the equity of a business. The inflow of revenue increases equity, whereas outflow decreases equity. The book also talks about not for profit. They can't show profit. Many managers use the terms expense and cost interchangeably, so don't let that confuse you, especially as a new manager. Flipping the page to page 46, the distinction between expense and cost here on the PowerPoint. Page 48 already goes into disbursements for services, so let me get caught up here with this PowerPoint. Expired costs and unexpired, yes, that was mentioned back on that first page also. Bear with me. Okay, here we go. Disbursements for services represent an expense stream, whether the expense is when the expense is incurred or after the expense is incurred. So disbursements, read about that on page 48. If I talk about it much more, it's going to confuse you and me. Grouping for expenses and planning and control. Cost centers are mentioned here. Diagnoses and procedures are discussed on page 49. Flip over to 50. Care settings and service lines. There's the book does a good job. I feel like I say that a lot. As you review this, let me know if you have any questions. There's not much I want to add or change just for the sake of not confusing anybody. Grouping by diagnosis and procedure, we can go back to page 49 at the bottom. It's common to group expenses by diagnosis and procedure for the purposes of planning and control, especially in hospital settings, but certainly you could do this in medical office settings. If you are a dermatologist and you have a patient coming in to get skin tag removed, you know you're going to need this, this, and this, and it's going to cost this, this, and this. So you can group that procedure together. Patients going in for tonsillectomies or coming back in post procedure for a knee replacement. Some of this stuff is just very predictable, so you group the diagnoses and the procedures. Here's an example of a hospital department cost classified by diagnoses. So their DRG code matches the descriptions, and the cost is pretty much the same for everybody. So yeah, they try to. Now let me go back to this. There may be one-offs that change some of these codes and these costs, and maybe one code will cover two or three things, but then a patient may have diabetes, so then it adds another code. But that this is the grouping of diagnosis and procedures. Diagnoses and procedures. Okay, so care setting, still giving you examples. Here we go. By care setting recognizes different sites where service is delivered. So it does cost different money if you're going to a medical office or a rehab or a hospital setting. Care settings were discussed in the previous chapter. Yeah, okay. Grouping by service lines. Also, another way to group things together because you do know the expected cost of someone leaving the hospital and then going to the rehab to build up their strength and then getting back home. What you do not want to do is to send somebody home too early, then they end up back in the hospital. That interferes with revenue because in the past 5 years, Medicaid and Medicare do not pay for a second hospital stay if there was an error on physician's part or if the outcome was not met. So keep that in mind too with revenue. You have to be really careful not to send somebody home too soon, but also not keep them too long either. Grouping by programs, this is discussed on the bottom of page 51. That's where it starts in the chapter. Exhibit 66, bottom of page 52. Mm-hmm. Costs reports as influencers of expense formats. So since the mid-60s, annual cost reports are required. Yes, since the Medicare and Medicaid, the governmental sources provide revenue for a hospital system or healthcare system, then they are entitled to expense reports. And so the formats are there for you. And that is it for this chapter. I have a worksheet for you to do. And yeah, again, I mentioned it in a video or two ago that the exercises and the worksheets are actually in the back of the book, and the answers are too. And the answers are often shared on the PowerPoints. So yeah, let me know if you have any questions.